Yep, we are up. Let me just refresh this here. There we are, guys.
We are live. We are live.
Good afternoon, everyone. Let us see, go here and post. Yes, good afternoon. Good afternoon, everyone. Welcome to Dollars and Cents. Welcome back to another Thursday, another episode, another chat with the team. Of course, I'm KP, and you all know Keisha and Billy. Wade isn't here, but he's in and out. But that's all right. That's how we do it. Busy people, busy lives. Thanks for supporting. If you're able to just share this information with friends or whoever else, that you can connect with, and we thank you for the support. Of course, dollars and cents. We talk about things that affect our community, right? We get into finances, and we've been doing that for a while, guys, right? We last month we delved into Black history, and we had a couple individuals. Well, I think we had Shannon on, right? She spoke to us about who we are and things that we didn't know about Canada and how Black folks were instrumental in doing certain things. I'll never forget Elijah McCoy. I'll never forget him.
The real McCoy.
Real McCoy, man. He's Canadian. And so this month we're dealing with health, right? Like I said, we normally deal with the finances, but we try to be as broad as possible when we're looking at our community, at our people. We're not apologetic, right, about that. While everyone can watch this or anyone can benefit from what we're saying, but we're looking at our folks. And so today we have with us our special guest, Dr. Cassandra Laleye.
Got it.
All right, all right. Welcome, Dr. Cass.
Thank you. Thank you for having me.
No worries, no worries. All right. So before we get into our talk, just gonna share a little bit here from your bio, and then we'll move on. All right. Dr. Cassandra Laleye is a chiropractor and medical acupuncture provider with experience treating an array of skeletal issues, including back pain, migraines, and neck pain, to name a few, through non invasive hands on techniques, including spinal adjustments, myofascial releases, and exercise prescription. Dr. Cassandra provides safe, effective, and personalized care to all her patients. Her aim is to empower her patients to reach their treatment goals, ensure their physical well being, and improve their overall quality of life. All right, let's give a little bit of educational background here, Doc. You know what? No, I'm not going to do that, Doc. I want you to talk, right?
Okay. Yeah. Yeah.
Um, you're
Yeah.
more than qualified. You're I see it all here. So the evidence is in writing. I want you to tell the folks who you are in terms of education and anything else that you want to share before we
Yes.
delve into who you are. All right.
Yes, and
So
please
what?
share a bit about your journey because we were even just talking a little bit offline, just how amazing it is to have a chiropractor, a black chiropractor, but then a female black chiropractor.
Mhm.
What your journey was as well in becoming Dr. Cass.
Thank
Yes.
you. Well, thank you again, guys. Thank you so much for having me. Thank you for the invite. I'm honored. I love speaking to especially our people. And I love that this is called Dollar and Cents. And I know that you guys talk a lot about finances, but I do think our wellness plays a big part in our productivity. So that's something we'll get into after. But there's definitely a common thread that both of those things share. So I definitely think if we can take care of our wellness, we can make more money. So So that is something that I think is super important. But thank you for the introduction. My name is Dr. Cassandra Laleye. I am a chiropractor here in the city. I mostly work in the east end of the city. I am of Nigerian descent, so both of my parents are Nigerian. They came here in the 70s, and then they had me and my siblings. I am one of 5 children. So how I got into chiropractic is being from a very traditional Nigerian household. Education was ingrained into us. Like, it wasn't a choice. You're going to school. I had people graduated high school and they're like, yeah, I don't know what I'm doing after high school. And I was like, there's a choice? What do you mean you don't know what you're doing after high school? I didn't know there were other options other than doing more school. So growing up, science was always my favorite subject. I excelled in sciences, biology, chemistry. I was always very good with those type things. So it kind of led me down the line to be like, okay, you're good in science, you're good in health. What do you want to do? So I said a doctor. Well, once you tell a Nigerian parent that you're going to be a doctor, there's no turning back. So you gotta be, we joke. And if there's anyone who knows, you probably heard this joke before, that you're only allowed to be 3 things. When it comes to Nigerian parents, yes, or probably African parents as a total, is like, you can only be a doctor, an engineer, a lawyer, and maybe a pastor, and that's it. Like, those are your.
Listen, even my family, because my family's from Ghana, it was a disappointment.
Yes.
When I told my parents I was going to pursue engineering instead of medicine.
Yes.
So I can relate. Yes.
So those are the choices. You grow up, you know those are your choices. Yes, exactly. So I knew that the traditional sense of doctor wasn't for me. I didn't want to be in a hospital. I played sports growing up, and I would see, when I would watch Raptors games or basketball games in general, I would see the person who would run out onto the court when the players were injured. And I'd be like, that's what I want to do. But how do I get there? Like, how do I do that? I don't want to be working in a hospital. I don't want to run like a family medicine practice. So how do I do that? So the only thing that I knew at that time, going into university, trying to figure out what I wanted to take, was physiotherapy. So I said, okay, I guess this is what it was going to be. So I did kinesiology at York University, 4-year kinesiology program, got my Bachelor of Science there. And as I was getting into like my 3rd, 4th year, when it was time to figure out what you wanted to do, I was like, okay, I'm going to go get my master's in physiotherapy. Come back to my very traditional Nigerian parents and tell them, I think I'm going to do physiotherapy. And my dad was just like, no, you're not. And I was just like, but this is what I want to do. This is what's going to make me feel fulfilled. And he told me, these are his words, not mine, because I work with amazing physiotherapists, you're going to be a personal trainer. And I said, it's a master's program. You're not going to be a personal trainer. So then I was working in a clinic at that time as a student, just helping around the clinic. And I saw a female, and she was a chiropractor. And I was like, oh, patients are calling you doctor. You're working hands-on. You're treating the body. This is exactly what I want to do. So I started talking to her about what chiropractic is. And she was explaining a lot of things to me, explaining the program, how you get into chiropractic school. And I was just like, that's it. It's chiropractic. I'm like, I get to work with my hands. And that's one thing that was really important with me. I was always really good at working with my hands. So I knew I wanted to do something that allowed me to work with my hands. And I'm just like, and then my parents got their doctor. So it's a win-win for everybody. I get to have a fulfilled career and my parents get their doctor. They get to brag to their friends that their daughter is a doctor. So everyone got what they wanted. So that has kind of been my journey. For those that don't know, chiropractic college is 4 years. So in total, I've been in school. I was in school for 8 years, 4 years for undergrad, 4 years for chiropractic for your doctorate. And at the end of it, you, after board exams and things like that, you become a registered chiropractic doctor. And I've been in practice this is my 6th year now. So I've been in practice for 6 years. So I'm still young. I'm still learning in my profession, but it has been a fulfilled, very much so fulfilled 6 years. And I am loving what I'm doing. And now, as I am more established in my practice, it is very important for me to do things like this and speak to our people about their health and about their wellness, because very often we don't get the same information that people who don't look like us get. We don't have access to the same healthcare resources all of the time. Or even if we do have access, we don't know how to go about getting those services, right? So just a very simple example I'll give is someone goes into their doctor, they say they have back pain. More chances are, if it is a person of color, particularly a Black person, they're going to be prescribed pain medication. If it is someone who is not of color, if it is a white person, more often they might be given other choices before we jump to pain medication. So other choices like being referred to a chiropractor, being referred to a physiotherapist, to try those lines of treatment before being prescribed pain medication. So that's just one instance of how knowing information, anyone can see a chiropractor. You don't need to be referred to see a chiropractor, but if you don't have that information, how do you know and how do you seek those services? So that's a little bit about me, my background, and what I do as a chiropractor.
That was so interesting. Well, first of all, again, so awesome that you're here. I'm just going to let everybody know Dr. Cass is my chiropractor. And she's been taking good care of me and my family. So, I just thought, like, she's just such a wealth of knowledge and information. And, just the fact that, honestly, she looks like us is something, too, that brings us a lot of comfort in seeking her expertise. I think it's very enlightening what you just shared about the method of treatment and the difference between how we're treated, Black people specifically, versus other communities. So I think this is very important because there are a lot of differences in the care that we receive versus other communities. Even my daughter was saying, was it my daughter or was it my son? Was saying the fact that there are no images of the Black body. When you go to the doctor's office and you see the body, it's always a white body. You have no images of the Black body and the anatomy and all that kind of stuff. And it wasn't until a fellow countryman of yours, a Nigerian doctor, who, made that first poster kind of thing with the Black body, and so it is so important that, we have that representation, because then we can see to some of those needs that, one, we may experience uniquely. Sometimes doctors don't even know how things look. I saw a story about doctors not sure how to deal with skin.
Yes.
And the way they look at our skin, like they don't know what's unique about our skin and stuff. So this is really, really important. I'm really grateful that you're here with us to sort of share some of your insights that can help us to advocate for ourselves, to ask for, additional resources. I think this is really, really important. So thank you for sharing your time with us.
No problem. Thank you for having me. And just touching on one thing that you said is that we can't be naive to the fact that, being of a different descent, and what that also means that you are of a different genetic makeup. And that's not to say that one ethnic group is better than another ethnic group. Is literally that has how genetics have developed over time. So there are differences on how our body looks and functions versus another cultural ethnic group. And it is our job as doctors to know these differences. But obviously, when white is the status quo, that is what is known. So even when patients come into this office, there are actual physical differences and I'm dealing with mostly musculoskeletal, so muscle, nervous system, and bones. But there are different ways in how we present in just structurally versus how other ethnic groups present. So if we don't have that information, it becomes very difficult. You miss things when it comes to treatment, right? And a lot of times doctors like to almost say, well, everybody's the same and I treat everybody the same. But you can't really treat everybody the same and give quality care if you're treating everybody the same, because realistically, we're not the same. So once you're treating everybody the same, the level of care does drop.
It's a problem, yeah.
Yeah, absolutely.
So
yes.
Just to sort of kick off here, I'm trying to think if I've ever gone to a chiropractor. I think I've brought my daughter to one.
Okay, I like to hear that.
I've ever done it.
Okay.
Okay, specifically though, where your office is where?
So my office where I accept new patients. So maybe I'll give a little bit of my background of where I treat as well. So I treat in Scarborough and I treat in East York. My Scarborough location is open to the public. I see everyone open to the public. So again, you don't need a referral. I'm at Kingston Road in Morningside in the Health Institute. But another little, just a fun tidbit of where else I work is I actually work in an addictions facility. So I work in a addictions hospital that treats mental health, addiction, and PTSD, things along that line. So that's an inpatient facility. So I don't see outside patients at that facility, but also it is just another thing that I'm really passionate about is how, and we'll talk about it actually a little bit today, is how mental health does actually affect how you physically feel as well. So that's also another area where I work in as well.
Okay. So my question is asking, like, what's the, when a person say is referred to a chiropractor, what can they look forward to? What would happen when they come in? And also, if we can add to that, like, what are some of the misconceptions as well?
Okay, perfect. I love this question. I really, really love this question. So one thing is when you come in to see a chiropractor, you're going to get a really thorough assessment. So we are looking at how are you moving? How do your joints move? How do you walk? These are little things that we get to pick up, especially if you're coming in for pain, but even if you're not coming in for pain. So one misconception that people have is that you need to be in pain to see a chiropractor, and that's not the truth. I actually like when patients come in that are not in pain because we're looking at prevention. Exactly. We're looking at prevention, right? So sometimes we can pick up on stuff that might be there that might lead to pain down the line, but because we've been able to catch it early, we don't have to get to that point of pain. So when you come in for your first appointment, you should expect a really thorough assessment. So we sit down, we chat, we take a history. I ask questions about your diet. I ask questions about your water intake. I ask questions about your movement, your stress levels. Like, what does a regular day look like for you? Because that lets us know a lot about what the body goes through in a day. So if you tell me that, you know what, my work is really hectic, and for the most part, I'm sitting 12 hours a day. That already prompts like 10 different things in my head, right? That lets me know. If you tell me I don't get really good sleep, I keep waking up with headaches, that prompts 10 different things in my head already. So just being able to know who the patient is in front of me lets me know a lot of stuff. So sometimes patients are just like, what does this have to do with my back? But I'm like, it has a lot to do with your back. If I know how you're sleeping, what are stress levels like? These past 2 years, I think I've never seen my patient population more stressed than they've been in these past 2 years. Obviously, we know what we've been dealing with for these past 2 years. We've been in COVID. I have my fellow chiropractor here, Dr. J. We always say, I've had the most tears in my office these past 2 years than I've ever had patients cry. And it's something that happens from time to time. But the stress levels these past 2 years have been through the roof. So when I'm asking patients about stress, it's because it lets me know what your body is dealing with. It lets me know what your body is being put through. So the first thing we do is a very thorough history where we're talking. And sometimes for that first appointment, if all we do is talk, I'm okay with that because the more information I have, the better. After we do we call it our history or our verbal assessment, we do a physical assessment. So this is where I'm looking at how is the body moving, right? We're assessing the joint. So if we're dealing with back pain, does it hurt if you're bending down to touch your toes? Does it hurt if I'm asking you to reach up and grab things, right? Because in the office, it might seem very clinical, but at home, if it's difficult for you to sit down and use the toilet and stand back up, then that's that same movement, right? So it lets me know, okay, I'm having difficulty getting out of bed every morning. So that lets me know maybe there's some rotational things happening. So that physical assessment is more for me to see how is the body actually moving, what muscles are involved, what joints are involved, what nerves are involved. And then once we do that, we come up with a treatment plan. And our treatment plan can be a variety of things. So like we said, I'm an acupuncture provider. So sometimes I'll include acupuncture. Sometimes I'll include different electrotherapy. Sometimes it's strictly all hands-on. But one thing all of my patients will let you know is that your treatment plan will always include movement. And Billie Jane knows this. You will move. So if you think you're coming here and it's just going to be, Dr. Cass is going to do all the hands-on, I'll always send my patients home with homework. Because I always tell them, if you come see me once a week, our initial is an hour, our follow-up is 40 minutes. if you come see me once a week for 40 minutes, that is not going to equate to all of the time that you're not seeing me during the week. So the hands-on stuff, it feels good. Everyone leaves feeling better. It feels amazing, but that's just a precursor for you to continue movement outside of the office. And honestly, people say I shouldn't say this because you won't make any money, but the hands-on work is not where the magic happens, and it's not where the job is done, right? It's the work at home. So if you continue the work at home, you see better results in the treatment. If you have your treatment, you feel good when you go home, and then we go back to sitting 12 hours a day, chances are you're going to come back and see me next week. And then one thing I always tell my patients is, I don't want to see you forever for the same thing. I want to see you, but we should be making progress. Like, we should be noticing changes after each appointment. Your movements, your homework that I'm giving you at home should be starting to get easier. So that's pretty much the treatment part. And then based on what we come up with, there's a certain amount of follow-up visits and so on and so forth. So that's kind of what you can expect when you come and see me for an assessment and for an appointment.
Okay. I just want to quickly interject before you answer the second part of the question. Now, I've always, when I've heard, chiropractor, I always think of your body just cracking up and just crack out of place. Like, my son, my older son, he sees or has seen a chiropractor. And I'm like, oh my gosh, like, how do you do that? Like, make sure that, they're not, taking things out of place. Right. So so I'm sure that is a myth. And,
absolutely. I'll touch on that. Yeah, for sure.
Yeah. So just kind of break that down for us, for someone like me who has that thought process.
Yeah.
That's why this is why it's not just the dollars, but it's the sense as well.
Yes, absolutely.
And this is what
absolutely. So I'll tell a funny story. So I told the story of how I told my parents, okay, you got to be a doctor, whatever. So even when I went to chiropractic school, my dad's for the first 2 years was still like, I don't know what you're doing. Like, I don't know what this chiropractic thing is, but okay, do your thing. My mom was seeing a chiropractor regularly, so she understood. And then when I was in second year of chiro school, my dad hurt his shoulder. So I'm like, Dad, go to mom's chiropractor. Go see dad's chiropractor. My dad finally went to see a chiropractor, and he's just like, oh my gosh, Cassandra, you're never going to believe what this man did to me. He's like, I heard my bones open. I heard crack, 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 crack. But I feel so good. And you know what? That day, my dad came home. He's like, oh, what do you need for school? Here's $100. Take $100. And he's just like, from there, he got it. So I totally understand that. One of the things is that a lot of people don't know, or we have misconceptions around what chiropractic is. And I do understand that the biggest thing we are known for is quote unquote cracking the back, right? We don't like that term that much, but you know what? I'm not against the term, because I know if it's easy to explain to a patient, I'm all for it. We call the actual cracking sensation an adjustment. So what we're looking to do is get movement into our spine. So our spine is pretty much the foundation of our whole body. All of your limbs, all of your bones attach into the spine. So typically what starts to happen over time is we get stiff through the spine. And just on a side note, I want to say this point is that as we age, we always hear people say, oh, I'm getting old. Oh, my back hurts and I'm getting old. But we're not getting old. We just typically stop moving as much as we get old than when we were younger. So it's not that we're getting old. It's that we've just changed how much we were moving as we aged. So just a little side note. But what we're looking for when we are doing an adjustment is to look for the areas that are not moving well. And I almost wish I had my spine beside me so that I could do you guys mind if I just run and
go ahead, Doc. We like that.
Yeah.
We need props in this.
Leave it to Keisha. I love it. Keeping it real, like, I don't know, this crack in the neck.
All this cracking thing. I don't know.
Perfect.
Can I be honest? I had it in my mind too, but I said, I'm not going to be the one today.
Leave it to Keisha. What is this crack in the neck thing?
We have to keep it real, right? Because we need this information. Because like my dad, someone probably won't go to the chiropractor because they think chiropractor is going to break their back.
Right.
So the more we get this information, the better, So our spine was made to move. Our body was made to move. Right. Over time, and especially over, let's say, the last like 200 years, we've progressively become a society that moves a lot less, right? So my grandfather was a farmer. He didn't have to go to the gym. He didn't need a chiropractor to give him exercises. Because you know what he did? He woke up every day and did manual labor. So he was just used to moving. But over the last century or so, we don't move as much. So our spine becomes stiffer. The regular movements that we were used to be, and even I would even say over the last, I'm 32, I went outside as a kid and I played and I moved.
Yeah.
And in the last, I've been practicing for 6 years. In the last 3 years, I've seen the most kids I've ever seen in my practice.
Wow.
And I equate it to they just don't move anymore.
Yes, yeah.
They sit at home, they play video games, they're on the computer.
So true.
So our
COVID did not help.
Yeah, it was made to move. It's malleable, it bends, we twist, we do a whole bunch of things that our spine was made to do. Over time, that if you don't use it or lose it, it sounds cliche, but it relates to the movement as well. If you're not continually telling your body that these movements are important, I need these movements, then it's going to lose it. It's going to say, oh, you know what, Cassandra, you haven't bent down in a year, so I guess you don't need spine flexion. We're just not going to have it there. So our job as a chiropractor is to come and put that movement back into the spine. And that's what our adjustments are. So we are trained for 4 years. So we were adjusting for 4 years, hours and hours and hours a day at school, learning how to be specific with adjustments. So you'll often hear people say, oh, I crack my own neck, I crack my own back. But the thing with us is that we're specific, right? We're feeling, where's that lack of mobility? Where can we find it? And that's what we're trying to create, is motion. So nothing is out of place. I always tell people, I'm not popping anything out of place. If you had an actual vertebrae out of place, you'd be paralyzed. Like you wouldn't be in my office, right? If it's out of place because, I don't know, you jumped off a cliff or something like that. Our bones just don't come out of place. But what we lose is we lose mobility, we lose motion, and we lose movement. And that can be restored through chiropractic adjustments. And the cracking motion, what you actually is so if anyone cracks their knuckles, it's just gas in the joint that escapes the joint. So that's what the actual noise is. It's gas leaving the joint. Yeah. So this is all bone. If I had like flesh and if I had ligaments and tissue around here, you would see that there's capsules around it. And just like anything that's a hollow space, almost like a balloon, there's air in it. So once you move it, so sometimes some people will roll over in bed and you'll feel your back crack. And it's just because you're putting enough tension on it that you're getting that release on your own. So that noise is just gas leaving the joint.
So like those little packaging that comes that we crack that we enjoy. Okay.
Yeah. So there's absolutely nothing wrong with cracking, because once again, my son, he cracks a lot. I'm like, you have to stop doing that.
I didn't say that. So thank you, Keisha, for bringing that up. So as chiropractors, we do not like people self-releasing. So there's two ways that this happens. There is just a total normal way where you stand up and your back will just realign, will just crack itself. There's nothing wrong with that because you're not putting extra tension. That's just kind of your body saying, okay, I've hit a tension point. You get a quick release. That's fine. But we don't like when people are actively trying to adjust themselves. So when you're actively trying to adjust yourself, that is a great sign that you need to go to the chiropractor. Because what's happening is your body is saying, okay, I'm tight in an area. So let's say this segment right here is not moving as we need it to move. The body is amazing at compensating. The body won't stop you until it needs to be stopped. So what it's going to do, it's going to say, how can I compensate for this region that's not moving? You know what it's going to do? It's going to say, okay, upper, you move more, lower, you move more, and that makes up for the one segment that's not moving. So you know what you're getting when you're releasing yourself? You're getting that segment that's already moving more upper and lower. You're not getting the restricted area. So you're just getting what the body has already given you to compensate, but you're not getting the area that actually needs to be released. So oftentimes when people come in, especially people, we call them self-adjusters. When people come in who are like chronic self-adjusters, they'll always say, oh, it doesn't feel like that when I release. And I'm like, yeah, I know it doesn't feel like that because you're not releasing what needs to be released. You're just releasing an area that's already moving. So I hope that made some sense.
Yeah.
Yeah.
Oh,
what
yeah.
About the cracking
adjustment for me from now on. I'm going to use the proper term, adjustment.
Okay. Thank you.
What about the cracking of hands?
Okay, so that's a good question. So there used to be a rumor or a theory that if you crack your hands a lot, that you're going to get arthritis.
Yes, that's what I grew up knowing, and that's
Yep.
what I said when my son did that. You need to stop because.
So you're not going to get arthritis if you crack your knuckles. You're not going to get arthriris.
That is not the message. I needed to bring my son here so he can hear you tell you what devastating things are going to happen to his head.
I know. Okay? I have to give you the science, though. I know. I have to give you the science, though. Yeah. So over years, I've heard it too. Like if you crack your knuckles, you're going to get arthritis. You're going to get arthritis. So you're not going to get arthritis from cracking your knuckles because arthritis comes from wear and tear on the bone that happens when there's load on the area. So the actual movement of cracking your knuckles doesn't actually load an area. So we tend to get arthritis kind of like in weight-bearing joints. So like hips, knees, ankles, sometimes in shoulders, depending if you're doing like a lot of heavy lifting or you work overhead or things like that. And then also you will just get arthritis as you age. Everyone is going to get arthritis. It's not a bad thing. As much as we're going to get wrinkles, we're going to get arthritis. It is a sign of aging. It doesn't mean you need to stop moving. It doesn't mean you need to slow down. It actually means you should move more. But what does happen in the joints when you constantly put movement into them is that we get laxity. And what laxity means is just things start to move too often. So typically what tends to happen with people who crack their knuckles is they can't stop cracking their knuckles. Mm-hmm. So once you stop, you almost can't stop. Once you start, you can't stop because now you've created that pattern where you have too much laxity in your joints. So you're not going to get so much of wear and tear arthritis, typical like osteoarthritis, but what you will have is you'll have increased laxity. So that can lead to its own problems as well, because these joints in our hands, they're the same type of joints in our knees, the same types of joints in our shoulders. So you can have other areas where you might be having too much fluid around the joint. You might have too much laxity, which means that the joint isn't as firm as it used to be. You can get weakness into your hands. So there are things that can happen, but will it cause quote unquote osteoarthritis? It's not going to cause osteoarthritis. You might be already prone to having osteoarthritis, especially if you work with your hands. So then we relate that with cracking the knuckles and the osteoarthritis. But just research-based, there's not a direct correlation between cracking your knuckles and osteoarthritis. But cracking your knuckles, again, constantly is not ideal for the joints.
Mm-hmm. Okay.
Yeah.
When you're dealing, Doc, with clients, right? Mm-hmm. What are things that's usually, of course, you focus on our community too. That's fine. What are things that are associated with our community as far as people coming in for adjustments? And also, if you can, also break down the differences between male, female, or the younger versus the older.
Oh, this is good. Yeah, this is a great question, KP. So, okay, let's start with our community first, and then I'll go into the other two. So the biggest thing that I find with our community is how chronic conditions are before we treat them.
Okay.
And it's sad. Like let's not sugarcoat it. It is sad because we typically don't, and I don't want to paintbrush it, but I want to paintbrush it. Mm-hmm. Because we typically don't address things until they really need to be addressed.
Okay.
And that is an issue. It's an issue, right? Like we can't really sugarcoat it, but we wait till it's too late. Not till it's too late, because I have had patients who it takes longer. Let me say that. So we don't come in when we first feel a little tweak. We don't come in when we first feel a little bit of discomfort. We come in when we can't get out of bed. We come in when I have to miss a month off of work. Mm-hmm. So we wait for things to get chronic. And unfortunately, one thing that sometimes is a factor for us, and we're talking dollars and cents, is that we don't want to spend the money. We don't want to spend the money. And we don't want to, I'm trying to think of a better way of saying it, but I can't really find other than being that blatant, is that we wait until it's that bad where we could have actually saved ourselves dollars. So when we're coming in, when you're telling me, oh, it started as back pain, but now it's shooting down my legs. Now I can't walk properly. I've missed a month of work. So you missed a month of work. We know even if you go on short-term disability, they don't pay you 100%. Something that maybe we could have cleared up in a month now is going to take us maybe 12 weeks, 4 months to clear up. So you end up spending more on that end. So when we were trying to just like push things off, we probably would have been better in the long run to address it right off of the bat. So that's the one thing I see. Now, I will say that is not always our fault, because we did talk about in the beginning information and access to care and knowing how to seek care, right?
Mm-hmm.
So it's not always our fault that we do wait till it's too long. Unfortunately, it is the pattern that's there, but I won't put all the blame on us, because there are societal things that have been set up that are reasons why a first option is not chiropractic care or any type of manual therapy for us compared to someone else. So one thing that I do see, and especially with our elderly folks, I do treat quite a bit of elderly folks, is that they were never told. So my parents are both in their 70s. My mom worked for the city for 25 years. I think she started using her benefits maybe 5 years ago.
That it just so happened that I had that question. Your services, who covers it?
I was going to ask that question too, because we're all guilty of it. Even me, myself, not using it, you know. I'm
like, Mom, you're not going for a massage. You know the two she used? She used dental. She made sure she pair of glasses. My mom said,
leave us alone. Leave us alone.
It's bad. Yeah.
Right? Yeah. I'm just like, okay, and medication if she ever needed it. And I said, those are the ones you're using. You're not going for a massage. And it wasn't until she got hurt that she started going to the chiropractor.
Yeah.
And I'm like, you have massage, you have physiotherapy, you have naturopath, you have dietitian. All of these things and benefits aren't free. As much as you feel like they're free, they're taking something out of your paycheck to pay for it, right? And I said, so Mom, you wasted 20 years of good city of Toronto benefits.
Yes.
For all of us. I was like, I played sports all my life. No one took me to get a massage. I was covered under my parents' benefits.
Yeah.
So a lot of, and honestly, I would say for their case as being Nigerian immigrants, I don't know if they knew.
Yeah.
Right?
Yeah.
I don't know if they knew that this is something that they could have access to, but I know friends of mine who were going to a chiropractor since they were children, who were getting massaged as children. I was like, children get massage. I just know the African style massage, they put shea butter on you and just massage you down in the house. But I was just like, no, people, right? People were getting actual like professional registered massage therapy as kids, right? And because one, their parents knew about it, right? So I think that's the biggest thing I see with our community is we usually don't tap into things unless we have to. And it goes back to that, what I was talking to before, is that you don't need to be in pain to go and see a chiropractor. It's a lot of it can just be prevention wise, right? In terms of, I think male and female was the next one. Biggest thing, male and female, especially for the females, is just going to be, because we're female, our hormones take a different toll on our body and do take a different toll in our healing. And do take a different toll in how we feel tension and stress and things of that nature. So one thing I do see is, especially in my women who are perimenopausal or menopausal, sometimes our healing slows down a little bit. And we're always like, Doc, I'm doing my exercises, I'm coming for treatment. What is it? And a lot of times there is a hormonal effect that it has on the body. So our hormones affect everything in the body. It affects how much inflammation you have in the body. It affects how much, especially for females, our estrogen levels. It plays a huge part. It affects how much fat we store in our body. So it plays a huge part on our body. So one thing that I will say is, we're talking about chiropractic today, but even seeking out other services like a naturopathic doctor, like a nutritionist, like a dietitian, these are all things that are services that we can use to make sure that our wellness overall plays a part. With men, the biggest thing with men is, as we age, this is for men and women, but as we age, it's the muscle loss. And then the other thing that I find with men is that, and let me speak from personal experience, because I have a 73-year-old dad who I go through with this, is that our men don't want to do anything in terms of keeping their strength or their movement up. But if you ask them, okay, we're going to move the bed today, we're going to move the dresser drawer today, we're going to do something, it's, oh yeah, I can do this. I'm 73. I can still do this. And it's just, why would you think you can still do this? And then you throw your back out. Right? But the amount of people I had in when we had that the snowstorm the other day, last month, I think it was, where we got the 40 to 60. I was just like, yeah, I was shoveling for 3 hours. And I was like, but you do no other physical activity during the year, no other physical activity during the week. And then we just said, all right, let's go shovel snow for 3 hours. And we thought the body was going to be up for that. It's like, why would it be up for that? Like, it is physical. You're sweating when you're shoveling snow. You're bending and picking up the snow, bending and picking up the snow. Like, it's actually a workout. So the thing that I see with men is more just the aging process as well. And it's just being able to keep up. Men are always going to have a little bit more, a lot more testosterone in the body. So a little bit more muscle mass. But as we age, that decreases. And I think mentally, men still think I'm a man. But unless you're doing things to actually keep up those levels, you can't just say, all right, I'm going to just try to muscle it today, or you're going to end up in the chiropractic office. So that's the biggest thing. And then I'll go to children next. Yeah. I think the biggest thing with children, what I'm seeing the pattern right now is that our kids are not moving anymore. And it's very, very, very sad to see is our kids are not moving anymore. They're on devices, they're playing video games, and they're not moving anymore. So they're coming in with more back pain, more headaches, things of that nature, which not saying that kids don't experience this, because kids can experience pain, kids can experience aches and pains, absolutely. But at the rate that it's going, their lack of movement is really starting to deteriorate their body, right? They go to school and they sit all day, and then they come home and they sit all day. There's no movement in between that, except if maybe they have an hour gym class 2 to 3 days a week. It's not enough. So that's the biggest thing that I'm seeing with kids, is that our kids don't move anymore at all.
Yeah.
Wow. But you definitely well, you said it already, but just to reemphasize it, that our children should be going to a chiropractor, getting our massages and all these different things.
Yeah, absolutely. So let me touch on one thing, KP, especially with kids. There are things that we can pick up in our children very early. So one thing that happens with kids that, if picked up early enough, can be addressed really early is scoliosis. Wow. And I had a friend of mine reach out to me asking me for some advice, because one of her friends, they didn't realize that the girl had changes in her spine till it got too late, that they had to send her to sick kids. And now she may need to be braced for 24 hours a day to try to realign it, because she has maybe a few more years before she's done puberty. And once you're in puberty, you're not growing anymore. So there are certain things that we can pick up in kids, which is also really why we want them to go for chiropractic checkups. Not saying that you're going to do the same adjustments on a child that you would do on an adult. Absolutely not, because you change your force as the body type changes. But there are so many things that we can pick up. We can pick up if they have leg length discrepancy. So we can pick up knock knees. We can pick up all of these things that happen in a child's body that when you pick up early, kids are very malleable. Their bodies respond to treatment like this. Like, when I treat children, it amazes me when parents mention me. They're like, oh, up to babies. Like, I treat newborn babies who have colic and they have gas and they won't stop crying, and mother or will not be able to latch, won't be able to breastfeed. And after one session, we can change it, because their nervous system is so primed for change, because that's how they grow, right? Kids are growing every single day. So if we catch these things while kids are young, it saves us trouble down the line. So yeah, making sure that kids also are assessed is super, super important as well.
Well, there you go, folks. Just making sure that, you're saying it, the doctor's saying it. So once you say it, then, it's much better than me saying it. But and also educating myself as well.
Absolutely.
Not as brave as Keisha, but I'll sneak some in there.
Hey.
I appreciate all of them.
Yeah, I don't know. Do we have time for one more question?
Yeah, at least one.
Yeah, because I know, Dr. Cass, you mentioned something about mental health and physical health, and so I would love to hear a little bit more about that.
Yeah, absolutely. Yeah, this is a great note to end on. So we try to separate the two, and it's impossible to separate the two. Many times, either a situation can start because of our mental health, or it can be made worse because of our mental health. So a lot of times people come in and they're like, you know what? When I'm stressed, my back feels the worst that it's ever been. And it's like, absolutely, your back feels the worst it's ever been when you're stressed. So let's talk about just the science level right now. When we're stressed, our cortisol go up. So cortisol is our stress hormone. Your body makes it when you're stressed. So sometimes we need cortisol. You are running a sprint and you have those jitters, your body produces cortisol. It's going to make you run really fast. You win your race. So cortisol levels are good sometimes. We don't like our stress levels or our cortisol levels to be high all the time, because it puts the body in an active state. So when you want to be in an active state, it's really good. When you want to be relaxed, we don't need high cortisol levels because it lets the body know it's always on. So imagine just being in that tensed on state all the time. It's going to wear the body down, because the body was meant to have some states where it's active on all the time, right? And it's supposed to have some moments where it's like, no, I'm cool, I'm chilling, I'm laid back. These last 2 years of COVID, everybody's been on. Everybody's been on like this. Like, we're all tight. Like, you can't relax. You don't even know why your shoulders feel tight. It's because we're stressed out. When your cortisol levels increase, you know what also increases? Inflammation increases in the body. Inflammation typically is what causes pain. So again, inflammation is not bad. It always gets a bad rap that people are like, oh, I'm so inflamed. We actually need inflammation, because inflammation is what starts the healing process. It lets the body know, red flag, there's a fire here. We need you to send resources here. So if we didn't have inflammation, we wouldn't have those processes go on. But prolonged inflammation is not good. We shouldn't be in a constant state of stress. We shouldn't be in a constant state of inflammation. So if you are already dealing with an injury, it's going to feel worse if you are stressed, because your body's going to have more cortisol levels in it and you're going to have more inflammation in it. On the other hand, how being stressed out and mental health and our mental well-being is, it leads to, again, your cortisol levels increase, your muscle tension increases. So imagine, I always tell my patients, I'm like, does it feel like your shoulders are by your ear sometimes? And it's just like, you just want to drop the shoulders down. So you're holding more tension in the body. That's going to lead to more aches and pains. Just the same way that our body wasn't made to be in that active state of tension, our shoulders shouldn't be here all the time. You're going to get a headache. Mm-hmm. You're absolutely going to get a headache. So a lot of times when people are saying, oh, I don't know where my headache came from, it's because you're stressed out. That's where the headache came from. I don't know why I keep having a headache. It's because you're stressed out. So once you start trying to separate your mental health from your physical well-being, you're doing yourself a disservice. You can't separate the two. If your mental health is not in a good state, if you're constantly stressed out, you're going to be in more pain and you're going to have more aches and pains in the body. Now, so one of the easiest things, and sometimes I tell my patients, you know what, I'm not giving you any homework today. The only homework you have to do is figure out a way, like, what is your way to deal with stress? What is your outlet? And it's so funny that a lot of people don't have an answer to that question. When I say, what is something that you do that is just for you? A lot of people don't have an answer to that question. So if you don't have an answer to that question, you have to find an answer to that question. Because if you stay in a high stress situation, it's not going to be good for your body whatsoever. It's going to lead to more problems. And we're just talking about like physical, musculoskeletal, but on all fronts. On all fronts. It increases your heart rate, it increases blood pressure, it increases cholesterol levels, it increases everything. So stress is something that's huge. It has to be taken care of. Absolutely.
The pandemic brought a lot of stress, Doc. I mean, what was that fallout for you there? Was there, a lot of increased amount of patients, or?
Yeah. Oh, absolutely. It was, and we like to be busy, but we want to be busy for good reasons, right? So we were definitely busier because a lot of people are stressed out, a lot more injuries, a lot more aches and pains, a lot more headaches. Yeah, we were definitely busy because a lot of people were dealing with this stressful situation. And a lot of times people say, well, I don't know why I feel why I'm in so much pain. I'm just at home. I'm not doing anything. You can be stressed and just be at home and not be doing anything and still be in a state of stress. You don't need to do anything to be stressed out. You're watching CP24 all day. That's more than enough to make you feel stressed out, right? So absolutely, we saw a huge increase in the office during COVID, especially when we were allowed to open back up, because we were shut down for a little bit. But when we were able to open back up, it definitely had an increase because that stress has an impact on the body.
And I think the mental, some individuals, like there's sometimes a comparison with someone sitting around a desk working versus someone who's out there physically, lifting up stuff. And that misconception is because you're lifting up these things that, you're having a whole lot more strain than someone who's actually doing that, a lot of that mental stuff, which can break you down just the same.
Absolutely. I would say my office workers are the worst. They're the worst. Absolutely. Because they can't take breaks. They have a very hard time taking breaks. I find that even at home was worse. When people were sitting at home, working from home, I found that they were worse than when they were working in the office, right? Because at least you got up and got some water. At least you went to the printer. At least you went to speak to someone in the next office. But now you're at home from wake up, don't even have to get out of the pajamas, go straight to the computer. There's those few minutes during the day where you get those breaks where at least, okay, I have my commute, even though it's Toronto traffic, maybe you're in traffic for a long time, or I'm going to actually eat breakfast. I'm actually going to make lunch. Like the amount of my patients who said they don't eat during the day anymore. And I'm just like, why aren't you taking a lunch break? Just because you're working from home, it should be the same schedule. You should still have a lunch break. But they're like, oh yeah, I don't have a lunch break. And I'm like, but if you're in the office, you would have a lunch break. So why wouldn't you have a lunch break at home? Right. So yeah, no, I find my office workers, I find them to be have a lot more strain and stress than people who are working manual labor. Yeah.
All right. Dr. Cass blowing us up.
Yes.
Calling out our bad behavior.
Such good information, man.
Yeah, man. Really, really appreciate you being on here, Doc.
Thank you. Thank you for having me. I really appreciate it.
Can I ask you just one thing? What would you want to leave us with? You shared so many gems. What should we walk away from this? Like if there's one thing that you would like us to take away, what would that be?
Okay, so this is great. So the biggest thing that I want us to know, especially because this is called dollars and cents, is that the first thing you need to take care of is your wellness. You're not going to make any kind of money. You're not going to make any kind of productivity, or you might do it in a very short stance, but it's not going to be sustainable unless you can find a way to maintain and sustain good, healthy habits and wellness. So the first thing that should always be a priority is your overall wellness. Everything else builds on that. The amount that you can work builds on that. How effectively you can show up builds on that. So the one thing that I would like people to leave with is make sure you're taking care of your overall health and wellness before anything else. Everything else will come after that. But if you're sick, what are you going to do? You can't show up to meetings. You can't meet up with clients, right? So health and wellness has to be a priority. That'd be my one take-home message.
All right. There you go, folks. We are going to have to leave it there. We're once again very happy and thankful for Dr. Cass being on here, enlightening us and helping us to be better and to do better when it comes to our health and wellness. Keisha.
Yeah, I just want to say that, it was a great time spent. The information provided was very jam-packed. As I always say, bringing knowledge and opportunity to those in our community. And this is what we want to bring, right? We speak of the dollars and cents, and it's not just about making that money. It's about the sense. We have to have the sense, to take care of ourselves. It's twofold. Yes, the money sense, but also the mental sense as well, and taking care of our body. I think this was great in terms of kind of unpacking, some of those myths. Like, I was raised very old-fashioned, and when you hear about this thing cracking up every minute, you're gonna take a spot out, or something. But I'm happy that you've taken the time to kind of like break that down. And if you're listening right now, or you're listening, later in the recording, please take some time to really do some investigating and, understand how this can benefit you. How can they contact you, individuals who might be interested, of course, in reaching out and just getting a little bit more information to lead up to, of course, using your services. How can one contact you?
Absolutely. So you can contact me through email. My email address is info@drcass.ca. My website is drcass.ca. And all of my contact information is on there. Always taking on new patients. Even if you just have a question, shoot me an email. I'd be happy to answer any kind of questions that anyone has.
Yeah, we'll make sure to put that information in there as well.
Yeah, we attached it to your pick and stuff, so they'll definitely have access to it. Any last thing, Billy, before we sign off?
This was great. It was very enlightening. And even though I am one of Dr. Gat's patient, I was enlightened by this conversation and thinking what more I need to be doing. She told me to drink more water. Look what I got.
No, I saw your water bottle and I was happy. I saw you taking a sip and I was so happy. I was like, that's my girl.
With the markings and everything. Markings and when, to be drinking. So, definitely taking heed of that. Next week is going to be exciting because we're going to be continuing on with the theme of, health and wellness. And we are going to be having a fitness expert joining us who is related to Dr. Cass. Miss Nike Charles is going to be joining us. So that's going to be really exciting. So I encourage everyone, come back, join us next week. We're going to be talking some more about health and wellness, continuing the conversation about moving. Dr. Cass was telling us we need to keep up our movement. It's the movement or lack thereof that's affecting our aging. So, I'm excited for our conversation next week. But yeah, you need to hit up Dr. Cass if you want to continue the conversation on, where you can improve your health and wellness as it relates to, your muscular skeletal, wellness and everything. So it's been an exciting conversation and I'm so grateful you were here and everyone who's joined us. So definitely put your comments. Let us know what you think about it.
Before we go, I think if there's one takeaway for me today is understanding what you do overall. Because once again, my mind was very one track, right? Just backing up the back type of situation. Right. But you definitely opened my mind. Right. And I hope that, she's opened up your mind as well with regards to when we're talking about water. That's what triggered me just now about drinking a lot of water, getting to the root of the problem or getting, doing things before you get to a problem.
Yes.
Right. So these things are so important. And I hope that you're listening. I hope that you're really taking this in because I think it was a wealth of information provided here today. Yeah.
Thank you guys so much for having me. I'm honored. Thank you.
Yeah, no worries. You hang on, Dak. We're just gonna sign off online here, but see you next Thursday, folks. You heard what we're gonna be doing. All right, take care.